Hi, so we're going to be working on the primitive reflexes for a baby today. So first one is going to be sucking. Preferably I would like to do this on a breast, but I can also do it with my finger. So I'm going to place it into the baby's mouth. And when this happens, I want to see if the baby automatically starts to wrap their tongue and their palate around my finger and automatically want to suck. This disappears within 1 to 4 months. Next one is going to be the rooting reflex. So I just come in and rub my finger along one side of their cheek, and what I'm looking for is for their face to go towards the direction that I'm rubbing. Oh, the sucking, if I didn't say, the sucking reflex disappears 1 to 4 months. The rooting reflex also disappears into 1 to 4 months. Next is going to be the palm mental. So I'm going to rub on the baby's hand, or on the palm of the baby's hand. And when I do so, I'm going to be looking for the upper lip to kind of elevate. This disappears within 5 to 6 months. Next is going to be the globular tap. So I'm just going to gently tap in between the baby's eyes on their forehead. And what I'm looking for is for them to basically blink and kind of like close their eyes. This disappears within 1 to 4 months. Next, we have the tonic neck reflex. So I'm just gonna kind of get the baby's attention in one direction, and when they turn, I'm looking for them to turn their neck to one side. When this happens, I'm looking for one arm and leg that the head is turned to extend. Yeah, like extend. And then the opposite side, I'm looking for it to bend. So, like so. This disappears within 5 to 7 months. Next is going to be the snout reflex. And this is, the doctor is going to then put their glove back on, like so, just because I'm around their mouth. And I'm just going to gently tap their upper lip. And when I do so, I'm looking for the baby to kind of pucker or elevate their lips. This disappears within about 6 months as well. Next is the Moro test. This is going to be when I'm going to basically hold the infant just a few centimeters off of the ground, like so. And then I'm going to gently drop their head. And when I do so, I'm looking for the baby's hands to open up, and then their arms should extend, then retract. Kind of like they're like trying to like grab for something. This disappears within about like 3 to 6 months. Next one is going to be the grasping reflex. So I'm going to place my finger in the baby's hand, and I'm looking for the baby to wrap their fingers around my finger. This disappears within 6 months. Next, I'm going to be doing the leg check. So you can do this in multiple ways. I'm going to do it supine, so laying on their back, and I'm just going to gently rotate their heels in and extend their legs out, and look for if one leg is shorter than the other. Results, if one leg was shorter than the other, then I just want to address possibly what's going on in the hip on the shorter side. Next is the Ortolani test. So I'm going to flex the hips and knees at 90 degrees and then apply pressure and then adduct the legs with my thumb, like so. Positive would indicate a hip dislocation, and I'm going to be looking for a distinct clunk during so. Last one is going to be the Barlow, and I'm just going to adduct the hip and apply a downward pressure. This indicates a hip dislocation.